You know, when it comes to supplying home health services for a loved one, you want to be sure that you have someone that you can rely on, that's dependable. You don't have to worry about your loved ones getting proper care. So speaking of care, Care and Home. Chad and Monica are here this morning from Care and Home here on the Gulf Coast. Welcome to the show again.
Thank you.
And definitely, having someone care for a loved one when in different situations is very important. Tell us a little bit about Care and Home Health Services, if you would.
Care and Homes, we're a family-owned company based here out of primarily in Gulfport. We service all of South Mississippi. We provide a full range of home care services, home health, which is skilled nurses, physical therapists, nurse aides, speech therapy, and occupational therapy. We also have hospice, private duty nursing, which is more of our sitters, private caregivers to help at the home. And we also have a durable medical equipment company.
So you pretty much run the wide gamut of everything when it comes to needs, when it comes to home health. And it doesn't necessarily have to be with elderly people. Can it be, if somebody's a rehab patient, young, my age?
Yeah, our primary population is the elderly, but no, any type of rehab that you need in the home, yes. We take care of all ages. So.
And what area of the Gulf Coast do you cover, Chad?
We cover all 3 coastal counties, and like I said, we go all the way up to Hattiesburg as well. So
okay.
All of South Mississippi.
And it's been a family thing for several years.
Close to 30 years now. So.
Wow, wow. So you started out as a child.
I did. I was a little baby running around, and now I'm there. So.
A little baby running around delivering oxygen bottles and everything. Okay, well, one of the things we want to talk about today, specifically, when and it falls under the realm of home health, is dementia, which is the older that we get, it is something that a lot of loved ones have to deal with. I mean, when it comes to and mainly with what do you call the children of the family dealing with a loved one and old. How do you deal with that?
A lot of it, and I'll let Monica speak to this some too, but a lot of that deals with the caregiver. As they get older, a lot of the care is geared towards the caregiver understanding what's going on with mom or dad as dementia progresses. There's a lot of issues there. We kind of take a multidisciplinary approach on the home health side with that, with our skilled nurses, our physical therapists, our occupational, our speech therapy, and also the aides.
What are some of the things, Monica, that a caregiver, which is normally the child, what are some of the things that they start to experience to begin with at the onset of dementia?
A lot of it is just keeping the person at home. We all want to stay in our home. So if we can bring peace of mind to the caregiver and to the patient, that they're safe, that's our first thing, but that they can continue to do all they can functionally, that meaning that they can take care of their daily activities. They can do their bathing, their eating. And sometimes the caregivers do have to step in and help with that. So it takes some training for the caregiver, because if you've never bathed a person, it can be frightening to both of you. So we get in.
Well, you do. I mean, you bathe babies, but when it comes to adults, that's a whole different thing.
Most people are not comfortable doing that on a day-to-day basis if you've never done it. And when you're dealing with someone with dementia, you want to stay calm, you want to be prepared, you don't want any sudden changes, because changes will upset them. It'll add to their anxiety, and once the demented patient gets anxious, the caregiver gets anxious. So if we can just calm everything down, bring peace of mind, it's really good for the whole family.
Can you talk about the difference between dementia and, say, Alzheimer's? What kind of difference there is?
There's not a lot. It's the diagnosis. A lot of people may have dementia, but not specifically the Alzheimer's diagnosis.
You hear people having early stages of dementia. What are some of the things that a caregiver is dealing with when it comes to early stages of dementia?
They're just forgetting. They're forgetting basic things. It's something that they can't remember. We all forget.
Oh, yeah.
We forget. But if you can't recall it ever, then you've probably got some dementia. It doesn't come back to you. You know how you can think of a name?
And that's one of the things, I guess, with the remembering and recalling things. Some of our speech, the multidisciplinary approach, the speech therapists do a really good job. We think of speech as swallowing and eating and things of that nature and speaking, but they also will have some exercises to work together, help recall, also help the caregiver understand what they're trying to say, because getting those basic thoughts out, something that's simple for a lot of us, kind of goes away in those early stages.
It's almost like there's a block.
Right, right. You have to remember.
It's like but it's like, they have like a blank look on their face.
And I think once we get caregivers to realize that dementia is a disease, this is a disease that's affecting the brain, and they just need to realize that that's still mother, that's still their father,
Right.
and they're full of personality. So you
Right.
still take care of the person and just work with the disease process.
Yeah, and another thing too is in that multidisciplinary approach, the physical therapist, you start to see some balance issues. A lot of your dementia patients have balance issues, their fall risk. So working on strengthening the lower legs, also as walkers or some other assistive device needs to come in.
Making their home safer.
They can help. They help with
That's
that.
another thing.
Yeah. So the therapists come in and they can make sure, one, they're safe with their device. One, the caregiver knows how that they need to be using it. Yeah, making sure, getting to and from the bathroom.
Everyone can benefit from a good home assessment to just see what's going on. And what I like to say is we bring a different level of support. We bring a level of support to the house, either with home health, and then if you need additional support, we've got hospice that we can offer.
And that's another thing too is, you're talking about a home assessment. You go into the home and you say, okay, this is the level that I know that you're dealing with this patient. We need to do this, and of course, here's where some of your medical equipment comes in. We maybe need to put some rails in the bathtub
Right.
or around the bath, and therefore you're helping them, get up and down, or they may need, assistance in other areas that, us as a normal, adult, we do it without thinking about it. But the thing is they can't think about it anymore because they don't remember it.
And it's new. As the caregiver, it's something new that they're having to deal with, and and as it progresses, things get tougher. So like Monica said, we have different service lines to help with early stages all the way to late. Especially at the end, as caregivers begin getting burned out and things, we do have private duty that's available, maybe just to come sit with them at night, give you a break, because it is taxing. It's taxing on not just the patient, but the family and everyone trying to take care of them.
And it's we have just a minute left, but it is a shame that there are times when a caregiver might feel like they're at their wits' end.
Right.
They don't know what to do, and they almost like they get annoyed and they want to lash out. It's like they can't help it.
They need some reassurance.
Exactly.
They need some reassurance. Stay calm, stay positive. We'll help them through it.
That's great. That's great. So if they want some more information about it, if they need an assessment or something, they just call your office.
Call the office. It's in the numbers on the screen, and then also we'll have our website, www.karenhome.com, and yeah, we can help them out.
Great. Thank you so much.
Thank
Good
you.
to see you,
Good to see you
Chad.
too.
Monica,
Thank
good to see
you.
y'all as always.
Thank you.
Again, if you have someone in your family or you know of someone, a loved one that is dealing with early stages of dementia or in more progressed stages of dementia, give Karen Home a call. Numbers on your screen. Go to the website, find out more about them, and see how they can bring Karen Home to your home.